Hemoglobin estimation. Learning objectives. By the end of this video, the participants will be able to explain estimation of hemoglobin by using Thales hemoglobinometer, hemoglobin color strip. Hemoglobin must be tested at the 4 scheduled antenatal visits and also every month for those found anemic. The iron requirement is significantly increased during pregnancy. And as such, if additional nutritious diet is not being taken during pregnancy, the woman can become anemic, which is a dangerous situation for her and her baby. A woman who has a hemoglobin level below 11 grams per dl at any given time during the pregnancy is considered to be suffering from anemia. Hemoglobin level and degree of anemia. Intervention. HB 11 grams gram percent, that is gram per deciliter or more, that is non-anemic. Prophylactic IFA tab, 1 tablet daily for 100 days. HB 7 to 11 grams, that is mild to moderate anemia. Therapeutic dose, 1 tablet twice a day for 100 days. HB less than 7 grams, that is severe anemia. To be managed by specialists at FRU and above. Her name to be noted down in the tracking register of severely anemic women. Items needed for HB testing and parts of Thales hemoglobinometer. Hemoglobinometer with a comparator on both sides. Pipette. It bears only one mark indicating 20 cmm per 0.02 ml and stirrer. Hemoglobin tube, that is HB tube. It is graduated on one side in gram percent from 2 gram percent to 24 gram percent, and on other side in percentage from 20% to 160%. Here we are using gram percent. This tube is called as Sarli-Adams tube. Material: a pair of gloves, spirit swabs, lancet, N/10 HCl, distilled water and dropper. You need to undertake the following steps before drawing the blood samples. Wash hands thoroughly with soap and water. Put on clean, high-level disinfected HLD gloves. Clean the HB tube and pipette. Fill the HB tube with N/10 HCl up to 20% or 2 gram percent with the dropper. Clean the tip of the woman's ring finger with an alcohol swab. Allow it to dry. Now you are ready to collect and test the blood sample. Prick the finger using the lancet and discard the first drop of blood by wiping with a sterile cotton swab and not the spirit swab. Dispose of the lancet in the puncture-proof container. Do not squeeze the fingertip to take out blood. Allow large drop of blood to form on the fingertip. Dip the tip of the HB pipette into the blood drop and suck blood up to the 20 cubic microliter mark on the pipette. While sucking blood, care should be taken to prevent entry of air. Immediately transfer the 20 cubic mm, that is 0.02 ml of blood from the pipette into the HB tube containing 0.1 normal HCl. Rinse the pipette 2 to 3 times by drawing up and blowing out the acid solution. Be cautious not to suck the liquid vigorously to avoid acid entering in your mouth. Leave the solution in the tube for about 10 minutes for conversion of hemoglobin into hematin. After 10 minutes, dilute the acid by adding distilled water drop by drop. Mix it with the stirrer and keep on matching the color of the solution with the comparator on both sides of the hemoglobinometer. When the color of the solution exactly matches that of the comparator on both sides of the hemoglobinometer, this expresses the hemoglobin content as gram percent. Note down the reading. Lower meniscus. Dispose of the contents of the HB tube in the sink attached to a closed drain. Rinse the HB tube with the acid solution so that it is ready for next use. Remove gloves by turning them inside out. Put them in 0.5% chlorine solution for 10 minutes for decontamination. Part 2. Hemoglobin estimation by using color strip. Learning objective. At the end of the activity, the participants will be able to estimate HB by color strips. Key messages. Another method of hemoglobin estimation is by using hemoglobin color strip. This method can be used for screening purposes to rule out anemia. This also helps in early detection of severe anemia. This method is to be used only at outreach session. The woman who is detected as anemic should get a confirmatory test at the nearest health facility where the extent of anemia can be more accurately measured. The materials needed for testing: lancet, spirit swab, color scale kit having matching strip, blotting paper. You need to undertake the following steps before drawing the blood sample. Hold the individual's finger, usually the left middle or ring finger. Wipe the area to be pricked, that is the side of the fingertip, with spirit swab. Allow it to dry. Prick the finger using the lancet. Dispose of the lancet in the puncture-proof container. Do not squeeze the fingertip to take out blood, and blot the blood sample on blotting paper of the color strip. Place a spirit swab on the finger and ask the person to press it with her thumb. Compare the color of the blood on the paper with the color on the paper to determine the hemoglobin level. Dispose of the blood-stained paper in the yellow bin. Record or note down the hemoglobin level and inform. Dispose of the swab. Key points. Early detection and correction of anemia during pregnancy is vital. Estimate hemoglobin at every antenatal checkup and administer IFA tablets as needed. Explain to the women the importance of consuming the IFA tablets.